Hi everyone, welcome to day 11 of our 12 Days of Wellness here at Ogden Clinic. Today we have Dr. Lori Ramirez from Ramirez Dermatology here at Ogden Clinic in Pleasant View, and she is going to tell us all about PRP hair loss injections, what they are, who can get them, and kind of what that procedure looks like. But I'm going to go ahead and let Dr. Ramirez introduce herself, and then we'll get started.
Hi everyone. I'm Lori Ramirez. I'm a board certified dermatologist and I've been practicing with the Ogden Clinic for the last several years. I was born and raised on Oahu, part Hawaiian, and moved to Utah about 13 to 14 years ago. And I just love it here. It's been just great. Our family really enjoys the outdoors and I'm here to stay.
Awesome. Well, we're so happy you're here at Ogden Clinic, and Dr. Ramirez is going to talk to us about these hair loss injections, but also at the end, she's going to mention some of the awesome things they also do here at Ramirez Dermatology. So just to get started, let's kind of talk a little bit about what these PRP injections are, what, they kind of entail, what they look like.
Sure. So PRP stands for plasma-rich platelet injections, and it's primarily used for women and men who experience female or male pattern hair loss. And that's a big number of individuals. So 21 million women, 50% of men experience hair loss, and it's pretty dramatic. A lot of women have been known to say, if my hair doesn't look good, I don't look good no matter what I'm wearing. I don't feel good. Once their hair, is what they want it to be, they actually feel really good. So these PRP injections are helpful in the sense it helps them gain their confidence back, their self-esteem back. And it started really in the 1980s. First, PRP was used in orthopedic surgery to help bone heal. It became really popular in 2000s with plasma treatments after microneedling, so the vampire facial. And then 2010 is when it became introduced for hair loss. And it's been helpful. So plasma-rich platelet is something that we do quite often in our clinic. It has, your blood's made up of 55% plasma. And when you spin it and concentrate it, you get these growth factors of platelets that are 5 to 6 times the normal concentration in regular blood. And so there's nutrients in there, there's hormones, there's growth factors, and it's useful when it's injected to stimulate the hair to grow and to get thicker.
Wow, that's really interesting. I didn't realize it was originally used for joints and it worked in different other ways. That's really interesting and fascinating. So a lot of people may know and some may not know there's a lot of different types of hair loss. So would these injections work for everyone, or is it for a specific type of hair loss that you would use these injections for?
Yes, that's a good question. So right now we just use these injections for females and males that experience more of that genetic hair loss. So their family, they probably know that one day they're going to start thinning. And it's for those individuals, not individuals with hair loss that are due to underlying disease, thyroid problems, for example, or lupus.
Mm-hmm.
There's some other scarring diseases of the scalp. So it's not meant for that, but most of our patients get it because they have a genetic predisposition to it.
Awesome. And is that how someone would know if they are, eligible for these injections? Like if they know it's something genetic?
Yes. So usually I see patients and we do a really good history. We do a good examination and sometimes we'll do some blood work. And if they all point to just that genetic predisposition, PRP is a really good option. Sometimes I'll combine it with hormonal therapy, and it's been shown to have an increased benefit for getting the hair to be a little bit thicker, a little bit darker, and stimulate the hair growth.
Awesome. And what does the procedure kind of look like? Let's say, someone watching today is like, hey, I feel like I may qualify. I want to go in for a visit. What does that procedure look like, and how long is this procedure?
How long does it take? So we had a patient today actually, and so I like to start with a really good evaluation. Patients all get a hair matrix study, and it looks at a really small portion of your scalp in 3 different areas, sort of the front, the middle, and the back. And within that small area, we can measure with a special tool how thick each hair is, how many hairs come out of one follicle, and how far apart they are. And so that's what we use to see if it's really working for individuals. So that part's done first. And as the patients are getting that done, we've kind of drawn their blood and we use it and spin it down to get that plasma. And the injection itself is really tolerable. It takes 5 or 10 minutes. We use ice to numb it up. And then the injections are done just about 1 centimeter apart, and we just focus where the patient has hair loss. And we just move around with the ice and injection and then just kind of go through the scalp, and patients tolerate it really well. It feels like a mild headache.
Yeah, that was going to be my next question. I think people that might be scared, to kind of do this procedure, that pain tolerance and knowing that it's not as painful as people might think it is. So
yes, we do have a few patients that are really worried about the needles, but the needle is really tiny and it isn't as bad as they think. And by the time we get through the tube, it's usually about 4 milliliters. It's done within 10 minutes.
Awesome. Yeah, I'm sure that's very helpful for people watching that might be fearful of needles or might think it's going to be a lot more painful. But after these injections, how long would someone expect to kind of see results?
So we usually do a series of injections from 1, 2, and 3 months. And I find that around the 3rd month is when patients start to really notice clinically, like they can see it. It's gotten a little bit thicker and the hair growth phase is a little bit longer, but it takes a little time for it to work. And so I've noticed that in 80 to 85% of women, they're starting to notice some improvement, and 30 to 35% of those really notice some hair thickening and increased density. Okay. So yeah, about 3 to 4 months is when I tell patients you start to see some results. After 3 or 4 months, we start spreading out the treatments to every 3 to 6 months, but there's no strict protocol. We kind of depend on the patient and see what they're doing and how their hair is growing.
Okay. And is there any other, things that they experience throughout this procedure? Like, is there any additional side effects or anything that might change, while they're doing this procedure?
It's so interesting. So I feel people get really emotional when they get their treatment, and it just triggers something because the loss of hair is so stressful, both psychologically and socially. They've had women and men who feel just so depressed about it. They're not only depressed, they're anxious, they're kind of obsessed with it. So sometimes when I have a patient and we're doing the treatment, they really start to cry. It's like a purge because they're so relieved to get something done.
Right.
But it is pretty emotional, and it's hard when I tell them not to stress, because stress just plays a role in hair loss. And once that's happening, it's hard not to stress about it. It's one of those really important features that if your hair is good, everything fits, everything's fine. So.
Right. I think it's similar, I guess, to anything else you're trying to, change in your life. You kind of have to wait for those results a little bit, but in the meantime, you're stressed or you're anxious or you're feeling all the emotions. So I'm sure this is very similar to any change you're making in your life.
It is. I think it really takes someone, you really have to understand the patient. It's something that I feel that people don't want to talk about, but they're really wanting someone to listen and also for someone to come in and do something that will help. So we do PRP. There's also other therapies that I combine with it that make a difference too. And we've had some really good success stories that make patients just feel really good about themselves.
That's awesome. Yeah, that's definitely, I think during the holidays, people start kind of thinking of making changes, or they might have New Year's resolutions. And I think hair loss might be one of those things that people really want to improve or fix during this time.
Another thing that I found really interesting and sort of unfortunate was during this last couple of years of COVID, people that got really sick and they had to be hospitalized have a natural tendency to just shed their hair, and it's really dramatic. So while the hair is kind of growing back, and if they're predisposed to having family members with female or male pattern hair loss, doing just PRP to help them get back on the right track has been helpful for them. So I've seen a lot of that in the last couple of years.
That's awesome. And how would someone, I guess, watching us today, if they're thinking about us or they're watching you listen about these injections, what message do you have for them? Not to be scared, to either come in for a consultation.
Yeah, be proactive, come in, let me do a good history and physical exam just to see. Sometimes there may be a vitamin that's missing in your diet. Maybe there's something in the blood work we need to check, but there's some options. And usually I find that most patients don't have the optimal mix of treatment. I mean, it might not work for everybody, to be honest, but at least you are doing something and you're getting over that stress of just sitting wondering. And I feel like when people take that step, they actually feel so much better just knowing that they're following some direction and they're doing the right things. That really helps.
And so you talked about how these injections are tailored more towards people that might have genetic hair loss. Is there options for people who might be experiencing hair loss due to stress?
So we do have that. So if you have stress that gets you like a physical illness, you're in the hospital, that's usually due to a temporary shedding of hair called telogen effluvium. Normally that happens not only with physical stress and sickness, but women who are pregnant experience that when they have a baby, and the hair typically grows back. So that's actually a good thing. Sometimes emotional stress can do that too. So if I know someone's just kind of thinking about it over and over again, I try to help them come up with a way to help manage the stress a little bit. And I find that they don't have time usually for themselves. So it's a little bit of medicine and a little bit of trying to get their other part of their life focused on more relaxing, not just focusing on the stress of having every single hair fall out every day. And I just don't want them to count the hairs.
Right.
It's not helpful to count. So we normally shed 100 hairs every day. Right. But I think that if you just focus on that, it's sort of just really bad circle of like, I can't stop thinking about it. Like when you try to diet,
makes it worse.
And then you can't do it. Right. So.
Right. Well, that's awesome. That's good to know that there's other, for people that are watching that may be like, well, it's not genetic, but I've been experiencing hair loss.
Yeah, there's definitely lots of reasons people have hair loss. And sometimes it's managing a lot of different things at the same time. So PRP can and may fit into your treatment protocol or regimen, but it really needs a good evaluation first. And to see if PRP is right, you can, come in and have a good checkup and a history for sure.
Absolutely. We actually do have 2 questions, it seems. So the first question is more of a serious question. It says, could it have an effect on your digestive system? So doing the
PRP, so PRP has really minimal side effects because it's using your own, they call it autologous blood. So it's using your own blood and plasma so that it really doesn't affect your system entirely. So there's really no allergic reaction to the PRP injections at all that I've noticed, and none reported in the literature.
Awesome. And then the second one, this is just asking a funny question. So if we're ticklish at all.
Even with needles?
Yeah.
So that hasn't happened yet. I have had patients who have had to do sort of skin biopsies on it. When I touch them, they're ticklish. But when I put the needle in, they're not ticklish. So there's ways around it. I think ice really helps in a lot of aspects, but no, you might be the first one. So
yeah, you never know. I'm sure everyone reacts differently.
Exactly.
That's awesome. Is there anything else that you would like to cover in regards to these PRP injections?
Sometimes we do for hair loss microneedling with PRP to help stimulate collagen, stimulate the hair to grow. So microneedling would be done first on the scalp, and it's something that you come in for. We use a device called the skin pen, and it's a really tiny motorized pen with 12 sterile needle tips, and it goes over the scalp, and such small little holes are placed, and the plasma then is put into the scalp or on the scalp, and that has been shown to be helpful too. There's also nutrients that we have that we could add to the PRP mixture that can be helpful. And of course, there's certain supplements that I usually encourage patients to have that are all natural, that increase the amount of hair growth that you can get to.
Awesome. And I guess this is something I'm curious about. What is how do you prepare for these? Like, is there something a patient has to do beforehand, or do they just come in and you get them all ready and they're good to go?
So usually I do a consult first. So we make sure there's not an underlying issue where the hair's not growing because of a vitamin deficiency, or there's other things like the thyroid's not working really well, or iron deficiency for women, for example. And once we go through that and I determine that it's most likely related not to those issues and to just the genetic predisposition, then we actually set up the appointment. And we usually allow for that appointment about half an hour.
Okay.
And we go through the evaluation part where we study the hair under
Mhm.
like a microscope almost, and then we do the injections with ice. And that part's really short. It's just more waiting to get the blood drawn, to get it spun, to get it looked at. But the
Right.
actual treatment's only 5 to 10 minutes.
Okay, that's crazy.
Yeah.
That's so short.
Yeah, it's a really.
I think you take longer being terrified than it
Yes.
takes to actually get them in.
It's so true.
So we're going to open it up for questions for the audience if you've been watching and you're curious about these injections or just any other questions in general for Dr. Ramirez. But I'm going to let you talk a little bit more about different things you have to offer here at Ramirez Dermatology and also maybe any specials that you have going on during this time. I know everyone's really big on holiday specials and
For
sales.
sure.
So we'll let people if they have any questions, but I'll let you talk about that as well.
So we post most of our specials on our Instagram page. It's Ramirez Dermatology. This December, we did 12 Days of Christmas, where in this 12-day box, I think we only have a couple left, we included a free chemical peel, but in one of those boxes was a golden ticket. So we did a free hydrofacial that we gave away. But there's some fun little half sizes of mostly SkinCeutical products that we put in there. So that was our December special, and most of it we'll post on our Instagram page. We have a really great aesthetic service that we like doing at a SkinCeuticals flagship store. So we have all of those products as well as Ulta MD. We have patients come in for a free consult under the skin scope. So that's kind of nice because I think a lot of patients when they're looking at skincare over the counter or online, they just don't know what is useful. And so to go through an evaluation, just have a few key things that are necessary that would be helpful for their skin is what we usually start with. And my goal is to get everyone to a point where they don't really need to have makeup. I mean, if they could just go out and just put maybe a tinted sunscreen on, then they would probably be my ideal
Absolutely.
patients.
That's everyone's dream.
Right? So having them on a good skincare regimen, and then usually we kind of broaden things up a little bit. Sometimes we'll do chemical peels to start with if we need some skin brightening or some brown spots treated. We don't do a lot of deep peels, but then some nice treats are hydrofacials. Those are always really nice. It's a great service that we have that includes a gel peel after the hydrofacial and a dermaplaning, which is really nice. I think I'm going to get one today after the
Awesome.
Facebook Live.
Yeah.
And then we do a series of laser treatments for hair and just, also for pigment. And we also do microneedling as well. So there's a lot of treatments that we end up having to do.
That's awesome. And how would someone make an appointment with you either for hair loss injections or anything else?
So if you call the Ogden Clinic number at 397-6125, there's two numbers. So one just for general derm is the one you'll kind of get transported through this phone tree and you can get to someone make an appointment for you. But if it's more for cosmetic services, including, hair, there is a separate line that you can just press and it gets you to someone that can schedule you much quicker for just cosmetic procedures. The other thing I didn't mention was Botox and fillers. So those kinds of things we just don't want people to have to wait for. They can come in sooner.
That's awesome.
Yeah.
Well, it doesn't look like we have any questions, but definitely if you do watch this live later in the day, like every other live we've had, feel free to leave your questions in the comments below, and I will get them over to Dr. Ramirez and she will answer them as fast as she can. Also, she did have a patient earlier today that actually went through this procedure that we talked about. So we'll be sharing images and videos in the comments as well. So if you want to see what it looks like, what to kind of expect, you're able to see that there as well. I will also link Dr. Ramirez's Instagram and then her website as well if you want to learn more about other procedures that she does as well. But thank you so much for being here with us today. It was such great information, and I hope there's someone out there that gets the courage to come and get those hair loss injections.
Yes, there's definitely something that can be done for sure.
Absolutely. Well, thank you so much.
Thank you.
And thank you, everyone.